Absolutely, I sure can. So I'll start just with some statistics. Why do we even need a Black Maternal Health Week? Because unfortunately, in the United States, 649 mothers who happen to be Black died while giving birth or shortly thereafter in the United States. And even though we have all of these advances health wise in the United States, and we are a developed country, the rates of morbidity and mortality for Black women have not gone down. They continue to go up, which is certainly not what we want to happen. There has been more people have been making more noise about it, but we still have a long way to go to even get the needle moving in the right direction. So, some of the reasons why our maternal mortality rate is so high is because, in general, when receiving medical training, even though it shouldn't be like this anymore, some very antiquated stereotypes still exist, unfortunately, that, Black women don't feel pain like other people do, which makes absolutely no sense. A lot of times, Black women will give certain symptoms, but then they get ignored. And so I'm happy that Glenda asked about having an advocate in the room, because what a lot of people don't realize is that at some point during your labor and delivery, the mom that is pregnant may be so sick that she may not even be able to speak for herself. So some of the things that I want to point out is that, number one, some misconceptions around morbidity and mortality dealing with Black maternal health is that the risk decreases, the risk of death or a horrible outcome decreases after the baby is born. That is not true. So there's risk all the way from gestation until after delivery. If a mother develops preeclampsia, that can happen during pregnancy, but she's actually at risk for symptoms of preeclampsia all the way up to a year postpartum, which means that she needs to be monitored for symptoms up to 12 months after she gives birth. And a lot of people don't know that. So, what is preeclampsia? Let's just start there. Preeclampsia is a severe condition in pregnancy, and it's dangerous because it can go from 0 to 10 very quickly. So some of the symptoms are, yes, 1 year after birth. I didn't know that my own self until I had preeclampsia. This needs to be live on LinkedIn as well. Oh, thank you. Hi, Larry. Thank you for joining me. Preeclampsia is dangerous. It can be asymptomatic, especially if the mother is not really in tune to her body, or if she's complaining about symptoms, but she's getting ignored. So, what are the symptoms? High blood pressure. High blood pressure, anything over 120 systolic, over 80 diastolic, it's considered high. So, if you have consistent high blood pressure that is not responding to medication, in addition to severe headaches, I'm not just talking about, a pesky headache that you might get that will go away with Tylenol. The headaches in preeclampsia, when you have preeclampsia, they are persistent and they are severe. It's like something that you cannot shake. You know if you're having a headache from preeclampsia because they are that bad. Sometimes you even can see spots in the sides of your eyes. From the peripheral view. A lot of times you'll get one of the first things you'll get swelling in your face and your hands. So ladies, if you wear rings and you were able to wear your rings all the way up to the time that it's time to give birth, and then suddenly you can't get your ring off anymore, that is a measure for you to say, okay, this is not quite what was happening a couple of days or even weeks ago. Upper abdominal pain. There's a syndrome called HELP that involves the liver and platelets. And so women will get pain in their right upper quadrant, strong abdominal pain. So as these symptoms go along, your certain lab values start going out of whack, you start spilling protein into your urine, and if you start trending towards eclampsia, which is when you go from preeclampsia, having the high blood pressure, the headaches, the upper abdominal pain, the swelling in your hands and feet, you can start seizing, which is called eclampsia, and we really don't want that. So mothers with preeclampsia have a super high risk of delivering prematurely. So I'm going to answer Glenda's question about having an advocate in the room with you. Part of the reason why it is important to have an advocate in the room with you is because you may not be able at one point to speak for yourself or to push the call button to find your nurse. Or if you don't have an advocate in the room with you, and say you're hospitalized because they're watching you, you're being monitored because you have preeclampsia, and visiting hours are over, you're in there by yourself. If you start tanking and you can't, you are incapacitated, you can go downhill very quickly. So having an advocate is extremely important because ideally that person is in the room just for you, and they are a part of your care from the time that you are in labor until the time that you deliver. And that advocate should know how your health is at baseline. So one of the things that I like to do, and one of the things that I did, was that I let my advocate, which happens to be my husband, know, hey, this is a checklist. If you notice that my face is swelling or I'm starting to look different, if you hear me complaining about headaches, more often, if you notice my vision is changing, or I'm just looking a little bit off, I need you to say something, because a lot of times we can't see ourselves the same way other people see us. And if you have your advocate should be someone that knows you and is familiar with you and that can speak on your behalf. But in order for them to do that in an effective way, they need to know, what the signs are, what the key words are that you need to say, who to alert. Do they go to the charge nurse? Who do they go if your nurse isn't quite paying attention to you and you need to get to your doctor? Are you at a teaching hospital where there are residents and fellows and there's this whole hierarchy that you know nothing about? You just know that you need help. Your advocate can be educated on the whole system of the medical team. You have the attending physician, who is the main person in charge. Then you have the fellow, who is after the attending. And then you have the residents who are training under them. You might have medical students in there. That can be confusing for people who are not familiar with labor and delivery, or with academic medicine, or being in an academic hospital. Hi, Crystal. Thank you for joining me. Hit like and share, please. So I'm speaking about why it's important to have an advocate in the room with you. One of the people who can serve as an advocate is a doula. Studies have showed that when Black women have doulas involved in their care, that their outcomes are, hi, Shamako. Thank you for joining me. Please hit like and share. Studies have shown that having a doula for Black women improves outcomes. So for people who have doulas, they kind of serve as their advocate. They are their sounding board. They're supporting the mother. They're letting the mother's OBGYN know, like, hey, my fetal monitoring strips, I don't like the way that this is trending. Can you come take a look? And then they also are comforting the mother, helping her to get in different birthing positions, and just kind of being a guide from the side. Larry and the LRLers probably are familiar with that term. So an advocate is really like your guide from the side. The good thing is Medicaid now covers doulas in a lot of states. So if you can get one, please do. I would strongly suggest that, because having a doula is one of the main factors that's helping people to make it out alive. So I want to go through another kind of hot topic, and it's a bit controversial. It's a birth plan. So for those who don't know, mothers and their partners can choose a birth plan. A birth plan is a document that basically tell you and your provider, your OB, go through, that tells you what kind of delivery you want. If you want to try to have a natural birth, if you want a vaginal delivery versus a C-section, if you want pain medicine or you don't want pain medicine, do you want the epidural or not? All of these things are discussed beforehand, and in a perfect world, the birth plan can be followed. However, when you have extenuating circumstances that put the mother and the baby's life in danger, that birth plan can very well go out the window. And I want to emphasize to mothers that I've been on both sides. I've given birth and I am a physician. So the whole point when you are having a baby is that you get mom and baby back home alive. So if you have a situation like preeclampsia, which is severe and life-threatening, nobody is going to be like, oh, let's just watch and see. That is not standard of care. So it's not necessarily that your team is disregarding your birth plan. The caveat with the birth plan is that it will be followed if it can be followed, if things go as planned. And anybody who has children after they're born know that they don't come with manuals and they don't follow schedules or plans, and they don't in utero and in the womb either. So I'm going to share about how I was able to get my husband to be my advocate. So with our first child, I kind of knew that something wasn't quite right, because my blood pressure was it just would not go down. Every time I went in to get checked, it was like 160 over 90 something. And again, remember the goal is 120 over 80. So me being a physician, I'm looking at this and I'm thinking, I really wish I didn't know what's probably going on, but I knew what was going on. So we did everything. I was on, 2-3 different medications. I was on bed rest, all the things. And my blood pressure still would not go down. And then the swelling started. And so I noticed, my hands started swelling. I took my ring off. My face got all puffy and everything. And so one day, thank you, Glenda. And another thing that helped me is that I am in tune with my body. So let me back up and say everyone should know what their normal is or their baseline is for your body. It's not going to be the same across the board. Hi, Prophetess Denise. Thank you for joining me. Please hit like and share. Everybody should know what their baseline is for you. So I knew that I was not feeling like myself. So what happened was I was 20 something weeks pregnant. Viability, which means that your baby has more than likely, they're going to live and make it. Used to be 24 weeks. Now it's a little bit earlier. So I think I was around that 28, 29 week mark when I was like, all right, and I saw my labs were trending in a way that they shouldn't have been, that was suggesting that, this is underlying preeclampsia. So I went in for a regular checkup. So I did not have a baby bag. I did not have a change of clothes. I didn't have anything because I was just supposed to be going to get my little ultrasound and get my blood pressure checked and get some labs drawn. So what happened was I went in and my blood pressure was, I believe it was like in the 170s, and the diastolic, or that bottom number, got to close to 100. And at that point, my heart kind of just dropped down into my stomach. I was like, they're not gonna let me go home. And the good thing is I had an excellent OB team. My OB was Black. We actually went to med school together, and I trusted her. So I knew that she was not going to let anything happen to me. Now, I might not have liked the recommendations. I hated being in that little ugly green room that I was in. It was like this horrible mint green. It looked sterile and everything. So they shipped me right. She said, Kim, Dr. Kim, I know you don't want to hear this, but we can't let you go home. And I said, okay, fine. All right. So I went and I got admitted. And I said, well, can y'all at least just give me my own room so I don't have to, share one? So I was able to get my own room, but I was kind of in shock. I mean, seriously, I thought I was going back home to be back on bed rest. I ended up, my whole entire self and my baby ended up in that hospital bed, and I stayed there for a couple of weeks. And all the while, I'm looking at my fetal monitoring strips. My daughter is not breathing like she should be and all the things. And I'm like, okay. So fortunately, before this happened, I had been telling Chris, I'm like, hey, that's my husband. I said, hey, I want you to make sure that you advocate for our daughter because she's probably going to be premature. And I need you to advocate for me and speak up for me if I can't speak up for myself. So I need you to call my doctor. So he had her personal cell phone number. Again, because I chose my OB, I trusted her. And so we had that type of relationship where I didn't have to go through nurses or the fellows to get to her. Ideally, that is what you want. If you can find an OB that you trust and one preferably that looks like you and that knows, what the risks are and what our experience as Black women can be, that is super helpful. So what my OB did, like she always called to check on me. She was on top of everything, my labs, checking my labs, having them drawn routinely, all the things. So to be quite honest, I probably shouldn't say this, but I'm gonna say it anyway. I was checking my labs in my chart and going through and reading them before they even were finalized because I knew that I could. And I know, Glenda, I'm like, I wasn't like the best patient. I'm just gonna go ahead and say I'm sorry, y'all. So my OB, one of her partners came in, and even my maternal medicine, OBGYN, my maternal fetal medicine, that's like the high grade doctor for the high risk patients. I knew her as well. We trained together. So she came in and everybody was giving me a pep talk like, Kim, it's going to be all right. We're going to make it through. And my whole thing, because of the type of work that I do, and I always see more often I see the horrible outcomes than the good outcomes. So I'm like, I don't want my baby being a preemie, and I don't want her being in the NICU. And what about this? And what about that? And they're like, do you want to live or don't you? And sometimes that's what you need. And I'm like, well, yeah, I do want to live, but I also don't want my daughter to be premature either. So I was seeing spots, y'all. I was supposed to tell them I was seeing spots, but I didn't say anything because my labs hadn't got that severe yet. And I had memorized the numbers on my hospital phone to get to my nurses. So not only was I seeing spots, I couldn't see anymore. And this was before I needed progressives, okay? My vision was blurry as I don't know what. That is another sign of preeclampsia. So my eyes are blurry, my blood pressure is all out of whack. My kidney function is not great anymore. I'm spilling protein into my urine. I'm having headaches that they're having to give me stronger medications for. I'm swollen. So I'm like, okay, this baby is coming out. It got to a point where I was laying in my bed, and I have shared the picture with some of you guys. I don't recognize myself in that picture. I was laying it before progressives. Prophetess Denise. That's how I knew it was pathologic. I'm like, I don't need glasses yet, but I cannot see. So once it got to that point, I was like, all right, I'm not going to gamble with my health anymore. So I dialed the number by faith, not by sight, because I swear to God, I could not see the numbers on the phone. And I told my team, I was like, hey, I can't see and I'm seeing spots. So she said, my OB said, okay, well, that means that we're going to have to, deliver you. By this time, I think I had just got to 31 weeks, 38, 39, 40 weeks, that's considered full term. So I, so she was trying to have me labor. She said, oh, you can push out a 2-pound baby. Let's start you on Pitocin. And I'm thinking, like, I'm not about to be laboring to push out a 2-pound baby, and I'm already having all these headaches and I can't see and all this. But see, I didn't tell them that I was seeing spots yet. So I said, oh, by the way, I'm seeing spots as well. She got on the phone so quick. She's like, get an OR ready right now. So I ended up being delivered by cesarean section. My daughter ended up, she was 2 pounds, 8 ounces. So minimum weight to bring your baby home from the hospital, everybody doesn't know, is 4 pounds. She was nowhere near that. So they whisked her away. I did not get the experience. And this will be a whole nother thing that I talk about, because it is a thing when you're with your baby as a mother and you can feel them, and like they're nice and tucked away in there. When you go full term, and I know this because with my son, it was a completely different experience, and I was able to carry him to near term. You have time to process what is going on and process that delivery, that separation period. When you have a preemie, you don't get that. It's like you go from being pregnant to not being pregnant and maybe getting a chance to see your baby. But because mine was a preemie and she was sick, I didn't even get, like, they didn't lay her on my chest or anything like that. And because I had preeclampsia, I had to go on a magnesium drip. And anybody who has ever gone on a magnesium drip knows that if you have ever felt like you were near death, magnesium will help you get to that feeling quicker. You feel absolutely awful. Now, because I'm a physician, I already knew, I'm like, okay, I'm probably not going to like how this magnesium makes me feel. Great. I'm expecting this already. So it got to a point where I was so unstable that the unit that I came from, the high risk unit, did not want to let me back into the room that I was in because I was so unstable. So they ended up putting me on the magnesium drip, and then I ended up back in my room. Y'all, there are several hours that I can't really account for because I was so out of it and I was so swollen. And remember, I didn't have a baby bag or any of that stuff. I came in as a size small, and I left out wearing a 2X. So I had told my husband after I delivered, I said, hey, can you go to Target real quick and get me some pants that I can actually wear? Hi, Dr. D, thank you for joining me. Please say like and share. And he went and got them, but I said, I need you to hurry up. And I said that because I could feel myself getting sicker and weaker. And I'm like, all right, I need you to hurry up. My husband is an Aquarius. And if Larry, if you still on here, y'all, you can attest that y'all don't really move fast if you don't deem it to be an emergency. So I really had to be like, no, I need you to go at 6 a.m. or whenever they first opened up and come right back. By the time he got back in there, he was trying to ask me if I was okay because I looked horrible. I was so weak, I could not press the call button for the nurse. I could barely get my chest to rise. Like my diaphragm it just felt like I just couldn't breathe. And so my monitor started beeping and everything. And so my husband went out and he's like, somebody needs to come in here. Where's the nurse? When's the last time y'all have checked her? All the things that I prepped him to do beforehand. That's why you need an advocate, and your advocate needs to be coached on what to look for and what to do. So he was able to get someone to come into my room. And when they saw my monitors, they were like, oh, let's call the OB stat. She came right down, and I could tell she was nervous because I knew her. She's like, okay, you got to try to breathe. You got to try to breathe. And I'm looking at her. I can't talk now. I'm looking like I am trying to breathe, but I can't. And so again, I'm still super swollen because I had preeclampsia. So by the time the phlebotomist came in to take my blood, because they needed to know what my magnesium level was, and there's no way to know that without getting a blood sample. I was so swollen that the phlebotomist could not find my vein. Another thing that I told my husband, I said, do not let any one person stick me more than twice without getting the vein before you ask for their supervisor. Thankfully, he was there and he saw she couldn't get it, and all my vitals are still tanking at this point. And so he went and got her supervisor. They got her supervisor and she got it right away. They drew my number to get my magnesium level stat. I had magnesium toxicity. What that means for all those that don't know is I was on my way up out of here. Okay, so they stopped magnesium right away and basically resuscitated me and got me back together. And that is my birth story. So if that can happen to me as a physician, knowing all the steps and all the things, the reason why I have been posting about Black Maternal Health Week is because there are no protective factors. Socioeconomic status goes out the window. Your education level goes out the window. How much money you make, rich, poor, it does not matter. Being Black alone is your biggest risk factor, period. And one of the things about preeclampsia, and I know the reason why, we need more Black patients to participate in studies about preeclampsia, but a lot of Black people, they have some reservations when it comes to clinical studies, and I don't blame them. But I said all that to say, this is why I have been making so much noise about Black Maternal Health Week, because preeclampsia can have you go from 0 to 100, and 100 is like you're gonna end up in the morgue. Okay, 100 is not good at this point in a split second. So how can we help to turn these numbers around? Educate, educate, educate. Let any pregnant person that you know, any Black, mother that you know, please stress to them, if you feel that something is not going right, even if you cannot say what that something is, because our intuition kicks in also. So you may not know, like early on, I kind of knew, I'm like, something just does not feel right with this. I didn't know I was going to have preeclampsia, but that's why I'm saying the importance of knowing what baseline is for you. If you feel at any point that you are not at baseline, say something and keep saying it until it is, number one, documented, and until the root cause of why you're feeling off is found out. So I'm going to end this by seeing if anyone has any questions and reviewing quickly what the key points for Black Maternal Health Week are. So the statistic is 649 Black mothers died in 2024, either during or after childbirth, which is ridiculous. Having a doula or an advocate has shown to be a protective factor and has led to better outcomes for Black women. The good news is that doulas are now covered by Medicaid in a lot of states. So please, please check and see. Have someone with you that you can trust. If you don't want a doula, assign someone to advocate for you. Talk to your OB and ask them, like, hey, how do I know if something's not going right? What should I look for? Sometimes they give out folders and booklets, but ask frequently so that it is in the back of your mind. Look out for signs of preeclampsia. If you have that severe headache, blurry vision, swelling in the hands or face, upper abdominal pain, you need to go in. If you're bleeding excessively after birth, you need to go back in. My point is, if anything does not feel right, and you are having a concern about it, use the nurse line, call and find out if you should go in. Do not sit at home and guess. So many unfortunate mothers have said, I'll just wait, because we'll push ourselves, especially Black women. We're like, oh, I'm not feeling good, but I'm just gonna. Don't do that. Please don't do that. Go in and let them send you home if you have to. And educate, educate, educate. I think that's it for me, guys. Oh, wow, no. Rhonda, you've never heard of Black Maternal Health Week? Ooh, see, that's why we have work to do. Yeah, it's every year. Oh, that is a good idea. Thank you, Glenda. No, never. We have work to do. That is why I have made my ending. I'm Kimmie, and if this isn't how life works for every Black woman giving birth, we've got work to do. We have got work to do. Everybody needs to be knowing about Black Maternal Health Week until we are not dying at alarming rates just for trying to have a baby, for goodness sakes. So I think I hit all of the points that I wanted to hit, but let me just check really quick, and then I'm going to see if anybody has any questions in the comments. So the reason I have explained today, the reason why Black women are 3 times more likely to die during childbirth than white women, the postpartum warning signs that every mother needs to know: the heavy bleeding, headaches, swelling still. Preeclampsia, please remember this, everybody. Preeclampsia can develop up until 1 year postpartum. That means 1 year after delivery. So just because baby is out does not mean you are out of the woodworks. You still need to be paying attention and watching out for those signs. And I'm just going to go ahead and say it. That 6-week checkup is not enough time for you to get checked. And then it's like, okay, with your OB, and then you're just, released to your own devices. That's not really enough time. Like, what if your symptoms develop after 6 weeks? Then what? So know your OB's nurse line number. Have that number available readily. Know your rights in the delivery room. Again, having a birth plan is great. If your pregnancy is going without complications, your birth plan should be followed. If you want to labor and to have a natural birth, you should be able to do that. If you want to have a water birth, you should be able to do that. If you want to have, a vacuum delivery, whatever, as long as everything is going fine, your birth plan should be followed. But please remember, if something is not going the way that it should be, that birth plan goes out the window, because the goal is to have you and your baby walk out of that hospital or birthing center alive at the end of the day. And what do you say when your OB dismisses you? The 9 words that I like to educate people on is to say, I need you to document in my chart that I am having XYZ symptom and that nothing is being done about it. I need you to document that I endorsed or I said that I'm having headaches. I need you to document. Have it in your chart. That way, if anything happens, there can be no denial that, oh, we didn't know. Yes, you did, because I said something. So use your voice, advocate, 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 know your body. If something doesn't feel right, it's probably not right. And that is it, everybody. Hit like and share. Thank you so much for joining me for my wrap up and conclusion of Black Maternal Health Week. And before we end, I'm just looking in the comments to see if I missed any questions. Glenda says, I love that I now have knowledge I can share with my friends and family. Yes, I love that too. Prophetess Denise, listen to your body. Yes. Rule of thumb, that's right, Denise. If it's not documented, it did not happen. And thank you, Rhonda. Rhonda says, this has been amazing. Thank you so much. Thank you, everyone, for joining me. And Don't let them stick you more than twice. If they can't find that vein, ask for somebody else. Okay. Time is of the essence when an emergency is at hand. Please hit like and share if you're watching the replay. And also, I would love to hear other people's birth stories. I read all the comments, even if it's after, even if it's the replay, and I reply. So please put it in. I know I'm not the only one that has had a preemie or has had a birth that didn't go quite as planned. But the good thing is she is doing well now, and so am I. And now I'm just continuing. Oh, yes, please subscribe for more information because I'm Kimmie. And if this isn't how life works for every Black woman that's giving birth, we've got work to do. Thank you all. Mwah, mwah, mwah. I appreciate you. Like and share this. And I will see you all again. Bye-bye.